Hello, and welcome to Health Information. I'm Lynn Reveneau, and we have with us tonight Dr. Eric Henriksen from Melrose Wakefield and Hallmark Health. I have to get up to speed to the new name. And we're talking about diagnostic imaging, which may be a 50-letter word for some people, so we're going to go through it easy and slow. We're focusing on diagnostic work tonight. You know, radiology has therapeutic work, but tonight we're focusing on diagnostic. So what's going on at Hallmark? New stuff.
Well, we're really a department on the move at Hallmark with diagnostic imaging as well as interventional, but tonight it's only diagnostic. We're making lots of changes and we're staying abreast of all the new technologies that are out there, and I'm really quite proud of the department. In Hallmark, which is a system, as you know, with 2 hospitals and several different off-sites, we have a cadre of diagnostic imaging equipment out there for referrers to send their patients to. It includes CT. We have 4 CTs in the system.
And CT, just for those of us who
CAT
have
scan.
been living in a cave? Okay.
CAT scan.
CAT scan.
And we're actually adding, replacing one at Melrose with a new unit. It's a 64-slice CT. It's one of the hottest items out there for CAT scanning, bringing new things to Hallmark and to our patients. We have ultrasound at several different sites. We have, obviously, X-ray, which we all know is at many different sites, bone density. Probably 2 years ago, we went all digital with mammography. We actually spoke about that on another show.
But mammography, just for people who may have missed that wonderful show, is a special diagnostic technique for breast cancer detection.
Yes, it is. Yes, it's a screening or a diagnostic test for determining whether or not there's breast cancer present. Okay. And
people should start having those at 40. Is that still the case?
If you're a low-risk patient, and there's some other categories, but yes, 40 is the starting point and yearly after that.
Okay, but say if you have breast cancer in your family, meaning mother, sister, how far out does it go?
Primarily, we stay to primary relatives, so it would be mother or sister. And if there is, it gets a little technical, but you can assume it this way, that if your mom had an early onset of breast cancer, you should start your screening 10 years earlier than your mom's date of detection. So if your mom had a breast cancer at, let's say, 40, you would start your screening at 30. And actually that goes back far enough so that you could be screened at 26. No one screens earlier than 25 years of age.
Okay, so you're pretty likely to be safe until that age.
Yes, you're likely to be safe.
But when you see your primary care doctor, that's who you would ask, which category am I in?
That's exactly right.
They would help you because it sounds like a complicated
process. It is, and that's their job, yeah.
Okay. So then you were saying, so breast imaging,
right.
What else were you
So we have breast imaging and all those other things we've already talked about. And then lastly, MRI. We have one, we're installing a new MRI at the Melrose campus. It's a high field magnet, and that complements the 2 MRIs we already have in the system over at Montvale Avenue in Stoneham. We have a high field magnet and an open magnet.
So those are the diagnostic tests that people are inside like a little cavern, a little baby cavern, and they also have ones that aren't that enclosed because some people don't like that.
That's right.
So
actually, they're
we're
all
ready with both.
Yes, and actually the high field magnets now, they're much more open than they used to be.
Okay.
And we're able to do people and often not even put them all the way into the magnet. So their techniques have improved greatly over the last few years.
Yes, because I can remember patients saying, I'm not going in those. I'm claustrophobic. And now you don't have to worry about that. Okay. And then how do they keep track of these studies? Because you have all these places.
Right. If you do the calculation,
it must be hundreds a week.
Of
everybody, all these things.
More than that, but yeah. But if you add up all the sites and all the modalities, you're into the hundreds at this point. And what the system did to move into the 21st century, and actually now a couple years ago, is to establish an electronic way to save these images. It's actually called PACS. It's a picture archiving and communication system. So that means that when you have your study, let's say you have your study at Melrose, and the radiologist can read it at another site if they happen to be expert in that field. At that very moment, the images are available across the whole system. And later that day, if you're in your referrer's office, your referring physician can see that same study on their desktop on the web.
So it's not just the Hallmark sites, it's 4 billion doctors' offices?
Well, it's those on staff at Hallmark, because, you know, there's HIPAA and all these regulations for the safety of your images. But obviously, if you're seeing your primary care and they're in the Hallmark system, they have access to that with your permission. So that's kind of exciting. And
getting close to that Dick Tracy watch that they used to talk
That's
about.
right. Yes, yes. Yeah.
Anyway, so all these studies are organized by this PACS system. Now, all the people involved, they must have many specializations.
Yeah,
So,
as we've gone along, I mean, I've been in this field now for, a few years, about 25. And we're heading now more and more, it's hard for one person to be an expert at everything. So
that's how we got specialties.
Yeah,
now
that's
we
right.
have the same problem in a specialty.
That's right. So our tendency now is we've brought on people that are specialists in their area, such as we have 3 interventionalists.
And what is that?
Those are the people that do the kind of interventional things that need to be done, draining abscesses or doing vessel studies
putting
or
tubes into you.
putting tubes into, yes, like Dr. Weibel, yes.
But which, though those may sound like they wouldn't be fun, they're a far cry and improvement over opening you up in the OR because we couldn't look in.
Yeah, very true. They're much less invasive.
Right.
So they're
So they're
really save you time in the hospital and save you discomfort.
Right.
They're really wonderful.
And quick recovery.
Yep. We also have now specialized radiologists in musculoskeletal, so that these are the guys or gals that are expert at like reading an MRI of your knee, if you've ever had one of those, or your MRI of your shoulder, or if you need something done to a joint, these are the experts that do that. We also have neuroradiology. We have 2 full-time and 3 part-time people, because that's such a specialized field that to give you the best, the patient the best, you really need to have those specialists. That last area for specialization that we have is breast. We have 3 people that really focus on breast. And, you know, it's kind of been shown that the more of a particular area that you do, if you do a significant amount of it, you're actually better at it.
Like when they used to say, don't have your heart surgery at a hospital that does it once a year.
Yes, that's...
I have the same idea here. Have your breast mammography done by somebody who's seen thousands.
That's right.
And then they pick up things quickly.
That's right.
Okay. So we talked about where and who. What about the equipment? Is there new stuff coming?
Yeah, thank you for asking. There is some new stuff coming. We have...
I'm seeing millions go out the window.
Well, PACS was about 6 million, so there's
wow.
a lot of expenditures, but you have to do this to stay current, and that's what you know Hallmark's mission is to stay current. Yeah, we're adding an MRI machine at Melrose Wakefield in the near term here in the fall, and we're also adding a 64 slice CT, and that's actually already been installed. So those 2 new pieces of equipment kind of lead us to some new testing areas.
And when you say 62 slice, you don't mean real slices. So,
No.
so nobody is nervous about being sliced.
No, it's really
This
kind
is
of...
picture slicing.
You can think
Imagery.
you can think about it as it's actually 64,
64,
but you can
okay.
think about it in terms of saying that a 64, it's like more lines on your TV, like a high definition TV
Oh, okay.
really has just a lot more lines, so the picture's crisper. Kind of the same thing with a 64 slice CT. It's just more receptors, more ways of getting information, so the images are just clearer.
So a blurry blob becomes something they can really identify.
That's right. CT was a blurry blob in 1985 when I started. Now it's crystal clear.
Wow.